Hello again. Now we are going to the last presentation of the cancer prevention seminar, chapter 18. During this presentation, I will give you the dessert. What I mean by dessert is that I will give you the extra. This is not in the program at all. This is just something extra that I believe it's important for people to know about cancer. So we have essentially three topics: forest bathing, detox diet, and the spontaneous regression of cancer. So we are going to talk about the importance of nature. We are going to talk about a program, a description of what we advise for people to change the diet. And then we are going to talk about some cases of cancer that regressed, reversed automatically, spontaneously, and how how this happened. So let's go for it, starting with the forest bathing. What is forest bathing? One time I asked in a lecture, do you know what forest bathing is? And then one person said, yes, it's taking a shower in a waterfall in the middle of the forest. But it's not with water. Forest bathing means when you go to the forest and then you immerse on the atmosphere of the forest, meaning that you are breathing the air, so you are having a bath, or you're having a bath with air. So what is that in the air that is good? Well, this air in the forest are full of things that are beneficial, as I will show. Forest bathing, going to the forest, increase the human natural killer activity, number of natural killer cells, and intracellular and anti-cancer proteins in lymphocytes. A forest bathing trip consists of time breathing in volatile substances called phytoncides that are essential oils from the wood, which are antimicrobial, volatile organic compounds derived from trees such as ipinine and limonene. So there was a study done in Japan with 12 healthy male subjects, aged 35 to 56, that they went for 3 days and 2 nights trip to a forest or to a city. And then they have similar activities during the trips. On day 1, the subjects walk for 2 hours in the afternoon in a forest field, and on day 2, they walk for 2 hours in the morning and afternoon, respectively. On day 3, the subjects finish the trip and return to Tokyo after drawing blood samples and completing the questionnaire. Blood urine were sampled in the 2nd and 3rd days during the trips, and on day 7 and 30 after the trips. Similar measures were made before the trips on a normal working day as the control. And then they do a kind of pre and post test. Phytoncide concentrations in forest and city air were measured. The results of the test showed that the forest bathing trip significantly increased the natural killer activity and the number of natural killer cells, and also the number of other enzymes like perforin, granulosin, and granzyme A and B expressing cells, and significantly decreased the concentration of adrenaline in the urine. Adrenaline is a stress hormone. The increased natural killer activity lasted for more than 7 days after the trip. After that, I promised myself that at least once a week I would go to the forest. I haven't been successful on that. But if we don't go anywhere from that, if you don't like what else I will say in the next slides, one thing we should learn that we should as much as possible, go for nature. Go for the mountain, for the beach, far from the city, as frequent as possible. If you are a cancer survivor, if you have a cancer risk, or even if you don't have any cancer risk, it would be good for you. Then they compare this with the tourists that visit the city, and then they figured out that none of these alterations were found. They only happened when they were in nature. And this was promoted by Lee Q. Morimoto. And then the other Kobayashi researcher from the Department of Hygiene and Public Health in the Nippon Medical School. This was conducted many years ago. I never seen a replication of this study, but there are several other studies that are being produced that somehow go in that direction, showing that there is some benefits in the air of the forests. Now we go to the second topic of this. Now we go for the second topic of this chapter 18, that is the detox diet. So many people, many cancer patients, and they would like to see what should they do in terms of diet. I advise to do the detox diet. That means that they should do a diet that is rich in fruits and vegetables, as we will mention. Who should do that? Everybody could do. Diabetics, maybe they should avoid to do detox diets with fruits and do more with vegetables. But they need medical supervision if they want to do. It's excellent for weight management, is excellent for sleep problems, fatigue, indigestion, headaches, general inflammation. Is excellent for digestive problems and is good for any chronic disease. So this means that for 3 to 7 days they will have only raw foods, fruits, vegetables, fruit juice, vegetable juice, and one portion of a juice should be 8 ounces or 250 mLs, and they should drink or eat that every 3 hours. And then should drink plenty of water, like more than 6 cups per day. I used to do that with my patients when I had a clinic, a lifestyle clinic in Brazil. It's very good for weight management. It's very good for general well-being. I remember I have one patient that came to the clinic that she had a problem with. She was taking a medicine for a chronic disease, and then her tongue was completely whitish. And she's staying 1 week with that, and her tongue became red again, like mine. Sorry. What kind of fruits and vegetables? Preferably organic fruits. Avoid avocado and nutty fruits. Berries would be okay. Hard skin, not necessarily to be organic, like orange, banana, pineapple, and mangoes. Dark green vegetables, better that should be organic, and better to use dark green vegetables. And eat and drink slowly. And if the person feels too hungry, drink one more cup or one more fruit. There is no limit on amount here. Sometimes we advise to eat some herbal teas. You can put some like mint, you can put on the juice, or you can eat some drinks if you feel okay. Not necessarily all of these, but remember that mint, chamomile, lemongrass are rich in substances that are antioxidants, so they are good to detox. If you have a problem with the constipation, so is good to use some teas like Senna or Cáscara Sagrada that are laxative. So just go slow on that. It's common that a person might be constipated if you use just a juice. So eating more vegetables and eating the fruit with the skin, or the ones that we can eat with the skin, will increase the movement, the intestinal movement. So you can use some diuretics if you have any edema, or if you have a problem to go to the bathroom. Usually you don't need to do that, because the detox diet will, and if you drink just water, will increase your urinary function. So what else you could do? What else you could do to increase the bowel movements? Eat oranges with pulp, eat plums or better prunes. Prune juice would be another help. Eat pineapple or pineapple fresh juice. Eat blackberries or smoothies made of berries. Blueberry is good also to increase the intestinal bowel movement. Another one is watermelon. Also, if you eat the watermelon with the pulp, it will increase the bowel movement. So this was the first week, I mean, just raw foods. And then in the second week, you can add some soups. And you can add a handful of nuts. And you can space the meals a little more every 4 hours. And then eat more dry foods. Avoid the dry foods with sugar. And then you can eat avocado. If you are too hungry, you can drink a little bit of dark grape juice per day, 1 cup. The third week, we promote the third week on a vegan diet. So if those are the ones, if your intention is to continue in a vegan diet, so you use a vegan diet, preferably organic foods, fruits and vegetables, beans, and beans and beans. Remember, Dr. Bean, 1 cup of bean per day. That's the prescription that we do for diabetes, hypertension, cholesterol, obesity, and heart disease. Whole wheat bread, better sprouted breads. Whole rice. Whole rice it would not be, you can eat daily. But if you have any of those diseases like diabetes and hypertension, you better not eat rice every day. Avoid fats, avoid refined grains, avoid junk food and fried foods. And also avoid canned foods and processed foods, all of these things. Not just avoid the meats and the dairy, but avoid the ones that are also processed. Yeah, as an example of a detox maintenance meal, I would say in the breakfast, eat granola, soy milk with whole wheat bread and fruits. You could use some nuts or nut paste or peanuts. But if you use nuts, don't use the peanuts. At lunch, you use vegetables, 1 cup of beans or other source of protein, like nuts, tofu, veggie meat, etc. And 1 carbohydrate, brown rice, potatoes, sweet potatoes, or other grains. Sweet potatoes are excellent source of fiber and excellent source of antioxidants, very anti-cancer food. And at dinner, you eat something a little lighter, soup with vegetables, toasted whole wheat bread, or bread with fruits and soy milk. And if you want to use jam, use a non-sugar ones. You can produce at home or buy the ones that don't have sugar added to it. If you need a snack, I would advise eat more fruits, or some vegetables, carrots, or some, you can use some crackers that are produced by, you can produce the crackers by yourself with whole grains, but you can buy crackers that are whole grains, but avoid too much processed foods. In the long term, what would advise for a cancer patient? Once a week fasting. If it's too much for you, one whole day, you could do just with fruits. Do one day with just fruits. If you want to fast, you could do bi-weekly or once a month. Or once a week or every 2 weeks, you could do just fruits. So you can choose whatever it fits you. When you are eating out, I mean, you could eat more salads. People say, well, I eat out and I cannot find the right fruits. And so salads you have salads everywhere. Every single restaurant has salads. So you could do substitute your meals for salad bars or fruits only. Avoid desserts. Use fruits instead of dessert. Remember, cancer cells, they like sugar. They like sweets. They like sugary foods. So the least that you use of sugar, the best. Avoid juices and drinks. Fresh juices are okay. If you want to drink juices, prefer fresh juices that you produce to drink. And drink a lot of water. Do not exercise during the first 2 weeks of detox. Walk daily is okay. Keep your body temperature warm because with this diet, the trend is to lower the body temperature, even in the summer. Keep your supplements, vitamins, and medication that you are prescribed. If you are diabetic, better not to do the first 2 weeks. But if you consult with the physician and he's okay, that's fine. If you take pills for diabetes and insulin, again, any medication that we are used to, you should not stop. What are the advice for supplementation? Eat more vitamin B12, that's the main one. Sometimes you need a little bit of calcium and then you can take a supplement. It should not be more than 500 milligrams per day. Foods, you can eat more dark green leaves that contain a little more calcium, or even soy or tofu also has some calcium on it. Vitamin D mostly comes from the sun. Either you take the sun or you take some pills of vitamin D. Go and do a periodical medical checkup, at least, well, this is your criteria, but it should be at least once a year. And then you have to adjust the medication. So you have to talk to your doctor because sometimes, for instance, blood pressure will drop if you do this type of detox diet. And so you need to drop the medication or adjust the medication. So you have to talk to your doctor about that there is this potential, mostly for blood pressure and blood glucose that they might drop. Now let's talk about the third topic of the chapter 6. Sorry. Now let's talk about the third topic of chapter 18, spontaneous reversal of cancer. You see a reversal in this picture. Cancer is inside and people are outside. They are rares. And that's what we wanna do. We wanna put cancer in a cage outside of our body, not inside of our body. We want to reverse. Is this possible? Well, we can try. We can use the techniques that are being used. But at least if it's not possible for every single cancer patient, at least you should, we will investigate what happened mostly to people that have a reversal of cancer. What they did, what was happening there. In 1964, there was a report that almost 50% of 196 cases of verified spontaneous regression of cancer were on those types of cancer. Bladder, neuroblastoma, that is a brain cancer, hypernephroma, that is a kidney cancer, stomach, breast, and then a sarcoma of the soft tissues. So those are the main types of cancer. And then there are some events that preceded the spontaneous regression. Sometimes it was an infection with a high fever. Then was a severe shock, like a coma or hemorrhage. And then was a partial tumor excisions and biopsies, so it was a surgery. And in some cases was pregnancy. The person became pregnant, the cancer disappeared. And then, but in many cases there were no identified biological event. Hirschberg in 1993 wrote like that: "It is possible to imagine that there is a spectrum of responses that can be brought about by each individual's natural self-repair mechanism. So he's saying that there is something inside of our body that could operate a cure of cancer. Then the placebo effect is an example of its operation at the lower end of the scale, and the remission of cancer should be at the high end of the scale. Our inner psychology might be able to create an environment that is inhospitable to cancer. If this is true or not, I don't know. But what I know is that once a person got the diagnosis of cancer, the main thing that goes after that is a sense of depression. And some people go to the deep level to suppress completely their immune system. So in any case, we advise that once you have the diagnosis of cancer, you should go for it. You should go for treatment. You should not give up. You should go for changes, because you don't have anything to lose. If you get to depression, then you have something to lose. Talking about the placebo effect, a case in the World Journal of Surgery in 1983, they reported a placebo-controlled trial of a chemotherapy agent in which 30% of the control group receiving a placebo lost all their hair. You know what's a placebo and experimental? They put chemotherapy in some pills, and they put sugar and flour in another pill. And then they mix that, and nobody knows who is receiving. And then the ones that were receiving the chemotherapy, they lost their hair. But the ones that are receiving the pills also lost their hair. So what's going on here? It's a placebo effect we cannot explain. Dr. Philip West reported some years ago on the case of a man with severe cancer. He wants the doctor to prescribe a drug called cribiosin, which was touted as a wonder drug. He had cancer, and then he said this drug is proven to cure cancer. After one dose of this drug, the patient's tumor started to melt like snowballs on a hot stove. He has a big tumor, and the tumor starts regressing. The patient no longer needed an oxygen mask to breathe, and even resumed piloting his own plane. When the man later read further reports that the drug was worthless, his cancer immediately began spreading again, and he required hospitalization, and he died a few days later. Was something in the mind of this person that he believed in that pill that makes his cancer to go away? But when he lost his faith on the pill, his cancer came back? It's just for you to think. And then we will finish with the reports of Dr. Ikemi from Japan. This was a very old report, and I never seen anything similar to this in the literature after that. But it was very interesting, the case. I select a couple of cases on that. YH was a male, 64 years old, was a pastor and a preacher in his religion, and then he was diagnosed with laryngeal cancer. He said that he would not go for surgery because this will take his voice and he would not be able to preach. He took the disease as a God will. God gave me health so far, God can take it away. This is God's will and I have no complaint about it. Whatever should happen will just happen. So what happened with YH? 2 months later, his voice improved. 4 months later, he started preaching again. And there were no evidence of laryngeal tumor later on. He died with 78 years old of an unrelated cause, a trauma in an accident to his back. So interesting the case. He just decided that he would not go to surgery, and then if he had to die, he would be with God. The KN case was a male with 77 years old. He had a diagnosis of stomach cancer in 1970, and he refused to go to surgery. He was also a pastor. His father was a founder of a church, and he was working with his father. He called the family council and friends and told them that he was going to serve the Lord in the remainder days of his life. He was satisfied if God would take his life at any time. But from that time, he was not a full-time pastor, but he said, I'm going to dedicate now my last years to preach the gospel. From that time on, he had fewer symptoms. He continued his church ministry. He was traveling, developing missionary work in other countries. And then in 1974, he did a gastroscopy that showed no tumor. And then until the year 75, when they reported this thing, the cancer disappeared. And then we have the last case of KA. KA was a female of 31 years old. She had stomach cancer with metastasis. So the stomach cancer was diagnosed, but it was already spread out to other organs. It was an adenocarcinoma. The surgeon removed 2/3 of her stomach and then told her that 3 months, she had 3 months of life because it was with metastasis. Frankly speaking, KA said, I was not afraid of cancer. That was because I had my religious faith. So the 3 cases are very religious people. But KA said, I had been a stubborn person and I feel that I had my corners rounded off by having cancer. Faith to me is not the attachment to life just wishing to be saved, but is the gratitude to God who saved my spirit. I began to live a real life since that time. And she mentioned that she decided to not be stubborn anymore. And she got her family together and she told them what was happening. And then she said that she would be a different person, and then she would treat everybody with a better treatment than she had done before. 9 years after that, no signs of cancer, no metastasis. This is a stage 4 type of cancer, but was regressed and reversed. Those cases were written in the Crosley 2004 book, Alternative Medicine Miracles. What are the lessons that we can take? Well, not all cases are like that. I have seen people saying, well, I dedicate my life totally to God, but the cancer didn't stop. And people say, well, this person was a very Christian person and was with the Lord all the time, but he died with cancer. Well, I cannot explain that. The lessons that I take from these cases that we mentioned about spontaneous regression of cancer are more mental. There is no anxiety or depression following the diagnostic of cancer. There is a previous devotion to religion. They gave themselves totally to God. They renewed their devotion to previous religious commitment. They took measures to reconstruct the relationship with other people. And they dedicate and they were okay if they have to die. I think that's the main thing. They were okay if they had to die. Once a person is diagnosed with cancer, it's not easy because death is imminent. But if you are able to overpass this and be content with the idea that you are going to die, maybe the disease, your immune system will be activated. I don't know. I'm not promising anything. Those are only lessons that we take from the other. But in any ways, one thing is important. Once we have the diagnostic, we should fight. We should not let it go. We should not think that we are going to die immediately. I heard from a friend that they check many cancer survivors in the past, and one thing they have in common, that was they are fighters. They will go and do whatever they could to fight the cancer. And then they didn't let the disease to take over. They didn't let the disease to take control of their lives. We finish this program, this cancer prevention seminar, with the messages in John 14, 1-3. Do not let your hearts be troubled. You believe in God, believe also in me. My Father's house has many rooms. If that were not so, would I have told you that I am going there to prepare a place for you? And if I go and prepare a place for you, I will come back and take you to be with me, that you also may be where I am. We believe that Jesus is in heaven. Jesus told this to us, for us to not be anxious, to not be in trouble with all the struggles and the risks that we have in this life. If we are ready to submit our lives to the Lord, He will give us eternal life. And He will take us to a world where cancer will not exist anymore. Free of cancer, finally. Total health, finally. Eternal life, finally. Thank you for your participation. Thank you for being with us. Peace be with you. The Lord be with you. And I hope you can apply this stop cancer prevention tips that we got in the program to your life, to your family, to your patients, to your relatives, to your friends. And take this to the community and help us in our fight against cancer. Cancer is a disease that is killing a lot of people, but we should fight. We, wherever, whenever we are, could do something about that. God bless you.